Welcome to the Robots for Infectious Diseases interview series. I'm Dr. Robin Murphy, the Raytheon Professor of Computer Science and Engineering at Texas A&M, and a founder of the Center for Robot-Assisted Search and Rescue. We have Jeff Braun here to describe some of the things that roboticists need to understand about emergency management. Jeff is an emergency management consultant, and he's currently supporting the Municipal District Services with the COVID-19 event. And although he doesn't show any visible scars or twitches, he was the emergency management coordinator for Fort Bend. That's the western part of the Metro Houston area. And that was during Hurricane Harvey, plus Hurricane Ike, and 6 other smaller presidentially declared disasters. Prior to that, he was a city manager in 4 communities, so he really knows how local governments handle emergencies. Welcome, Jeff. Thank you for making time for us.
Thanks for inviting me. I'm looking forward to the conversation.
Dr. Jason Moats will be interviewing Jeff. Jason's an Associate Division Director of the Emergency Services Training Institute at Texas A&M's Engineering Extension Service, and he has a joint appointment with the Bush School of Government and Public Policy. And it's leveraging his decades of experience in all aspects of emergency management. He was also a co-host of the White House OSTP workshops on robotics for infectious diseases in the 2015 Ebola outbreak, and he's been providing a user-centric push for robots ever since. Welcome, Jason. Take it away, please.
Thanks, Robin. And Jeff, welcome. It's good to see you.
Thank you.
So I want to jump right into this because we've got a lot of ground to cover. Can you talk to us a little bit about what it's like to be a public official during a pandemic?
Well, it's not an easy thing. We'll say that right off the beginning. The pandemic is a little bit different than the normal natural hazards we usually deal with, hurricanes and flooding and those types of activities. The pandemic kind of moves at a different rhythm, and the public officials, the people that I would report to as the emergency management coordinator, the elected officials, the mayors and the county executives, they have some really difficult decisions to make, and that's really true in this COVID-19 situation because with the lack of resources, there is some real issues with priorities of who gets what resources and who gets served, and it's unfortunate. And the one thing that makes it really difficult is that unlike a hurricane or a tropical storm that affects one small part of the country, a pandemic there's a disaster declaration declared in all 50 states. So everybody wants the same types of resources and information.
Okay. So, talking about robots and drones, what types of information could Sentry robots and drones provide to health officials or even those making the policy?
It's an area that, is kind of a new one to think about from the emergency management side. During the flooding in Fort Bend during 2016 and 2017 with Hurricane Harvey, we worked with CRAZAR to look at, how we could use unmanned aerial vehicles, unmanned maritime vehicles to get information that we needed. So the bottom line is the health director of a county, the emergency management coordinator, the chief elected official. What do they want? They want data and they want information. So public health is looking at the same issues in concert with emergency management. And I think some of the key areas that I would think are setting up well for robotics would be some things like telemedicine, and bringing the ability to talk to doctors in somebody's home environment, because everybody in the pandemic is needing to shelter at home. So that's one possible area I think that's really good. Another one that we deal with, and the company that I'm kind of assisting right now is they work in the public sector, but they're a private company. A lot of issues about disinfecting areas, and it's a very manual operation. There may be ways to look at disinfection of surfaces, especially in an area like the provision of a critical infrastructure like water service. So that's one other area that we're looking at and that I think would be good. And then, another area is just using unmanned aerial vehicles to provide some degree of reconnaissance. That has some pitfalls of its own, but that's another area where public health might find that to be beneficial.
Okay. So do you think robots could be used, of all those things, do you think they could be used to support the enforcement of quarantines, or should that be left up to law enforcement officers?
Well, I think it could be used for that, and I think it would probably be in concert with law enforcement, working either with their own robotics or bringing somebody in that would be working under the supervision of law enforcement. There are some examples of where that's been done in other countries. There have been some small examples, I believe, in Elizabeth, New Jersey, recently, where they used the, you can say they used it to provide information to the public, but what they were doing was looking to see if anybody was out against whatever their shelter-in-place law is or their curfew. That gets into the slippery slope that we have in the United States compared to other countries, which is we like our privacy here, and our country, being a democracy, allows us to have a lot of independence, whereas some countries are a little more autocratic, and they have the ability to use unmanned aerial vehicles, for example, to surveil their population and find folks that are not doing what they want and take actions that I think we would find in the United States to be a little bit too much. And I think that's what's happening right now during COVID-19. There's kind of a push-pull that the public officials have to weigh, going back to your first question, which is how much do we invade somebody's privacy at the same time that we know that that information could be very helpful to us in providing for the greater good.
Okay. I've got kind of a twofold question. I want to go off of something you said and add something to it. You talked about in Elizabeth, New Jersey, they were using it to provide information to the public. So my question is, how effective do you think a robot doing that would be? And then the second part of the question is, if we were going to use robots for that purpose, or let's say to deliver food and supplies, who would make that call?
Okay, let me start with the second part first, which is the decision-making during a pandemic is going to be handled just pretty much in the same way that we would handle disaster management during any natural hazard. There's a kind of a chain of command, or a chain of coordination, if you will, that involves incidents happening at the local level and then going up to the county level, up to the state level, up to the governor's level, and then up to the federal level. A lot of times for resources and how do we get resources. A lot of times it doesn't really work in reverse when it comes to regulations. Regulations and who makes the decision can happen in different areas. Right now there's a big push-pull between the governors and the president about who gets to make some of the decisions. That's really not the issue at the local level. At the local level, the chief executive officer usually has that power, but I would doubt the chief executive officer, whether it be he or a she, would take action without consulting their public health authority on what would be the best way to provide information out to the public. So the decision-making process is really at the local level for some things, and then it goes up to the state level for other things. And as you notice, the CDC, which is the arm of the federal government that's providing guidelines to the governors to take actions. I think that the decision to make, to go ahead and use, say, surveillance technology would be one that the chief executive officer would make at a local level. And like I said, there would be some pros and cons to doing that.
Okay. we've talked a little bit about surveillance, and that probably would, as you mentioned, would probably be frowned on in the U.S. But do you think what's important about? Well, let me ask the question this way: is it important for citizens to be able to trust the robots and or have positive interactions with them?
Absolutely. I mean, I go back to the first iterations, I guess, from my standpoint, being in Fort Bend County, when we started being exposed to unmanned aerial vehicles, probably called drones or something else back then. But everybody had this idea what that was, and that idea wasn't anything about what we were trying to do in Fort Bend County in terms of getting data on how to make evacuation routes, or how to survey damage on levees, or how to survey damage of other types of damage that would have happened from a tornado or winds. And people would hear the word drone and they thought it was surveillance, they thought it was weaponized, a lot of things that were not good until they became more accustomed to it. I think that's when it became more acceptable. I think there is a reason that you have to be able to trust the technology, and I don't know if this is too corny to bring up, but I always go back to, I think it's 2004, 2003, the I, Robot movie, which had the scene in there where the main character is Will Smith. He's talking to his grandmother, and he's actually basically being kind of a bigot against robots, which is kind of funny. And she's like, I didn't raise you to be a bigot. And the issue is, in the movie, which I could almost see some of this maybe taking place at some point, they had robots that were, I would say, social robots that kept the elderly company and helped them take their medicine and things like that. He didn't buy into it, but the person that was being served by the robot did. And, I thought about that scene when I thought about this pandemic, where everybody is so isolated in treatments, whether they're in the hospital and their families can't see them, or whether they're just isolated in their house, where some type of a social robot that can be set up to allow you to connect easily with your family through means that we do now, such as Facebook or FaceTime or something like that, but also maybe do a little bit of med checks, temperatures, things like that, and maybe not be quite as imposing as it would be. So I think everybody just has to get comfortable with that. And at this moment, it just kind of made me think of a few things that might actually work if people were comfortable with the technology.
Well, great, Jeff. We got just a tiny bit of time left, but I want to ask you, what do you think the greatest need is that robots could address during the pandemic?
I think, a couple things, and I talked about them or mentioned them already. I think there is a big need for, in the area of the social robots, telemedicine. I think there's some other areas that are more operational, maybe some type of robotic equipment that could take contaminated medical waste out of facilities and dispose of them in the proper way, so that we could reduce the interaction of human beings with something that is that perhaps toxic. The reconnaissance, the surveillance, I think it's got some possibilities. Maybe spread of public information in targeted areas would be good. But there's one area that I, didn't mention that I think is important. And I don't really know what the solution is yet, but in the last, several months of working with a private company that does water and wastewater, I was thinking that one of the biggest issues we have right now is continuity of operations. So maybe the robotic sense isn't to fight the pandemic, It's to let us do our regular business in a way so that our manpower can be shifted over to the business of the day, which is the pandemic. And maybe there's ways to run wastewater treatment plants or water treatment plants in a more, at least in an effective way for short periods of time, maybe longer periods of time, that allow us to kind of maximize the limited staffing that we have. So I kind of just want to put a plug in there for continuity of operations being something that's kind of off the beaten path a little bit.
All right, Jeff. Well, thank you so much for spending some time with us on this. And Robin, I'll give it back to you.
Well, thank you. And Jeff, that was great. And everyone, do watch Robots for Infectious Disease, the webpage. We'll have more interviews, reports, and other activities.